This pandemic has changed virtually every aspect of American life, including the race for the White House, where the campaigns of the two leading Democratic candidates have moved from rallies with big crowds to virtual messages to supporters. And it's brought one of them back to Washington to focus on the stimulus package we've been discussing. Independent Senator Bernie Sanders of Vermont joins me now from the Capitol. Senator Sanders, what is your view at this point of what you know about the status of this effort to aid hospitals, but mainly to help American workers and small and large businesses?
Well, what I believe is going to be the case is that there will be a massive, unprecedented expansion of unemployment compensation, which includes workers who today are not covered by unemployment. Over half the workers in America today are not covered. People who drive Uber cars, people who are in the gig economy, and then we have the problem of a lot of tipped employees, workers who are making $2.50 minimum wage. So this will be unprecedented. My understanding is it will be 100% of people's salaries for 4 months. And that's something that we fought for very, very hard to make sure that we make workers whole. In the small business provision, which is also going to be very, very expensive, what we are saying there is that if small businesses retain their employees, not fire them, even when they are at home, there will be loans to the small businesses which will be forgiven, as I understand it, if they retain their workers. Also, what we're talking about, which I think is not enough, but it's a start, is $1,200 for every adult in this country, earning less than $75,500 for the children. Obviously, a major, major concern now is that hospitals all over this country, especially in New York City, Washington, elsewhere, are being inundated with coronavirus patients. They need help. I believe there's $130 billion on the way to help them. Clearly, unbelievably, we don't have enough masks or gloves or gowns for our doctors and nurses who are putting their lives on the line. There's money available to make sure that as soon as possible they get the equipment they need to protect themselves and treat their patients.
So, Senator, at this point, is this something you would support?
I got to see the details, and the details are not out yet. I think at the end of the day, given the fact that we have an unprecedented economic crisis, some people are suggesting that unemployment might go above 20–25% by the end of June. We have an unprecedented healthcare crisis. Clear to me that we have got to move as aggressively as we possibly can to protect working families in this country. One of the areas where I do have concerns, I haven't seen all the details yet, I don't know that they have been negotiated, is I am very uncomfortable with giving Donald Trump and his administration $500 billion to use in any way they want. That worries me a whole lot. And we'll see if there has been some improvement in that situation in the last few hours.
Yeah, and we were told that there's been serious conversation, negotiations over an inspector general and over an oversight board. So, but we're waiting, as you say, to see the details. Senator, another piece of this is that one of your campaign co-chairs, who's Congressman Ro Khanna of California, has called on the president to issue essentially a national shelter-in-place order for the next few weeks. Is this something you agree with?
Well, I'll tell you what I do think. I think that what I do think is I am very worried about a president who is ignoring medical advice and the leading scientific experts in this country who talks about trying to open the economy and bringing people back to work who may be sick. This could be enormously dangerous for this country. And I worry about that very much. I think in terms of a national shutdown, I think you got to look at various states at where they're at. New York City is now in crisis. Washington State is in crisis. Other states maybe not so much. But clearly, the goal right now is to do everything possible to stop the spread of the epidemic, to have the resources to treat those people who are ill to be prepared for what may happen in the fall, because there is a fear that even if we are able to significantly lower the epidemic right now, it may resurface in the fall. There's an enormous amount of work to be done.
And I'm sure you know their argument is that that if the economy is completely decimated, people's lives, their livelihoods are going to be ruined, and that's something that has to be weighed in the balance. So at the very least, they're talking about looking at geographic areas that are not so-called hotspots and lifting some restrictions there.
Well, you know, that gets into the whole issue of why we don't have enough tests. I mean, I think what the experts are telling us, that if the day comes when there is a workforce that is tested every day and nobody is positive, that's okay. People can go to work. But right now, we're woefully inadequate in terms of our testing situation. Judy, I would also add is that in this unprecedented moment, as we fight our way out of this crisis, and I kind of believe that Congress will be back in the not terribly distant future after this bill is passed, because there will continue to be enormously unmet needs that are out there. We have got to ask some hard questions. How did we get to where we are right now? Why are so many people in this country desperate? What people are afraid of, and what I am afraid of, is that half of our country is living paycheck to paycheck. What happens when those paychecks stop? $1,200 for an adult?
No.
Yeah, well, that's fine for a few weeks. It is not fine for a long period of time. How do we make everybody in this country whole? How do we give confidence to the American people that the government will be by their side? Now, you know, Trump talks about the fact that, you know, a bad economy is bad. People are going to be hurt. Of course, that's true. But at the end of the day, our job is to keep people healthy, keep people alive, and do everything we can to get the resources, economic resources, to people. Money is money. Life is life. People die, you know, that's not what we want. So the first priority has got to be to protect the health of the American people, and then we have to rebuild the economy. But short term, government has got to do everything it can to make working people whole in this process.
Senator Bernie Sanders, candidate for president, for the Democratic nomination for president, thank you very much.
Thank you, Judy.